Hi everyone. What exactly is a hammer toe and what exactly is a bunion? A question I get asked every day. I'm Dr. Po Raval, nearing 35 years of practice as a podiatrist. So let's look at this chart. Bunions and hammer toes 101. So a bunion is the big toe joint and a deviation in that joint. So if you notice, it's crooked. A hammer toe, on the other hand, is this, where the small toe, or not just the small toe, all your smaller toes, this could be toes 2 through 5, we call it, start to buckle. So they start to look like this. So a bunion is always the big toe and hammer toes are always the smaller toes. So exactly what causes this to happen? So there is definitely a big genetic basis to bunions and hammer toes developing. If you look at someone in your family, you are more likely to have what they have. However, most bunions and hammer toes develop over time. That means if you start to see them when you're younger, in your under 20 or over 20, that means that something in the way that you're walking or your tendons are beginning to cause it. And nowadays we're very proactive. Surgery is not your only option. We start to do things like orthotics at a very young age. This is a custom. And if you notice, like this woman had a bunion and hammer toes. So the drop off is always in the joint. So if your bunions or hammer toes are like this, the correction is always behind the joint. So we correct and we drop the joint. So what that does is when you start to walk, it starts to become straight. So that's one way to control a hammer toe. Bunions, we always put a spacer in. So when they start to deviate, it kind of pushes the toe over. And we try to correct the joint behind it. So when you start to walk, it begins to straighten. So by designing a custom orthotic and by doing certain stretches, you can actually prevent a bunion or hammer toe from developing. And at the very least, you can try to improve it. Very important to understand that you're not changing the bone. What you're actually changing in orthotics is changing the tendon. So if you change the way the tendon functions, you are in essence straightening a hammer toe or bunion. If you have to straighten, if your bunion or hammer toe are very bad and they're rigid, meaning there's no way you have flexibility, then you have to go and have them corrected with surgery. So hammer toe and bunions, in a nutshell, are a deviation of the joint. Hammer toes like this, bunions are a deviation like this, and both of them do have a genetic basis. So I hope that helps.